Hello and welcome to the North Richmond Community Health Podcast. This is where we directly engage our local community and local health experts together to discuss any topic that's on our minds. My name's Mia and I'll be your host. Today this episode is about the Hurrah team, and this is an acronym for High Risk Accommodation Response Team. So who are they, I hear ask? Well, for anyone who's living in public housing, you know them as the team who have been helping to prevent, prepare for and respond early to the COVID-19 infections within the area. So they've been there to provide care packages to residents, deep clean properties, provide access to COVID testing, and that's just a start. Now, every public housing area has a Hurrah, but the North Richmond Hurrah is distinct in that the team are made up of individuals from Richmond Public Housing. And later in the podcast, we will discuss how this has helped connect the community during the pandemic and helped to ultimately achieve one of the highest vaccination rates in Victoria. So this episode is for the residents of North Richmond Community Housing, so we can get to know more about the people that you see working on the front line. And this episode will also be for people who don't live in public housing. Perhaps you've heard news segments about outbreaks in public housing within Victoria, and you might be wondering how the system works and how they've helped to keep the community safe. So this is also our very first podcast, so welcome. Thank you for joining us. Let's get into it.
My name's Wayne. I've lived on this estate for 14 years now. My job here, first of all, is the health support officer, but now I also have two jobs, community liaison, and that involves engaging with the community and just getting to know them and getting to gain their trust, and yeah.
My name is Laura O'Shea. I've worked on the Richmond Housing Estate for about 10 years. And I'm a resident in the city of Yarra, and I am the Senior Project Coordinator for the High Risk Accommodation Response, which is a fancy sort of word for, our COVID response on the estate, and manage a team of about 20 people who are all awesome.
Yeah, hi, hello. My name is Martha Monyping. I work with North Richmond Community Health Centre and in Hurrah team as Community Liaison. I work with community to engage them in activities and look after them in terms of COVID, and because of these high rises, it's a high risk, and therefore we are there to help them look after themselves.
I enjoy getting out there and meeting more people and showing our concerns that we're here to help you and things like that, and also seeing them outside of work and getting the thank yous so much for helping us.
I love that every day is different. Every day is really challenging. We have to be really agile as a team, and the teamwork factor for me is just incredible to observe. Such an incredible team that are so diverse, and they speak over 15 languages, and we all come together with a common, goal, and that is to support this local community. And that's, you walk away from a day at work and you think, that was amazing. I learnt more lessons about people, humans, myself.
The Hurrah team are all tenants from the towers. How has this experience been for you?
Yes, having to work in a place where it's full of diversity, people comes in with different thoughts and personalities, and for me to work and adjust into making it possible that I'm understandable in terms of other people's, and trying to work hard in making sure that even when I'm working, I make someone day by just, checking on them if they are okay.
These guys coming onto our team, they've created themselves as leaders in this community, and we know we've got some amazing existing community leaders that work and, live and advocate for the Richmond Housing Estate, which is really essential, and we still connect with them every day and every week. But we have now created, almost 20 leaders within our team, and I think that that has been the absolute success story. I say it all the time. You know, there's no way we would have achieved what we've achieved, and it's been pretty significant, I think, what we've achieved in managing huge outbreaks on the estate and really having exceptionally high vaccination rates. We know some of our towers or most of our towers now are 100% first dose vaccinated. And that is no small undertaking. And I think it's fair to say that we've got a lot of passion in this team and a lot of exhausted people that probably at some point will need a little bit of a break, a bit of a holiday. But we know that that's contributing to managing these current outbreaks and keeping them, you know, much more contained than they were last year. We're not seeing the spread that we were seeing.
People who know Wayne already might have met him in the supermarket before. People who work with me were ladies that know me down under the school. They might be schooling together with me. So we tap into it and then sort of bringing them along, say, you know, there is something going on. Do you want to be part of it? Have you been vaccinated? Are you okay? Is kids okay? So, and that, I think that's what builds the trust between us and the community, and that's what works for us.
I think working where the estate is a big advantage. But I also think that we've done things pretty creatively and given our team a lot of autonomy, you know, so to sort of come up with the ideas. I think we've got a deeply empowered team who come to work and say, oh my God, I was thinking last night, I think that we can solve this problem by doing this. And we just then listen, they design it.
When there was an outbreak over in one of the flats in Collingwood, that we all sort of worked collectively and went over there to help them out. And so that was really like rewarding to actually be like noticed that we do good work and for us to be sent over there to help those guys too. That was really good that time.
The partnerships is everything, you know. This has not just been a North Richmond response. It's been a collective. You know, our partners at Belgium Avenue Neighbourhood House have been absolutely instrumental in our engagement with the community. You know, why reinvent the wheel? Why duplicate effort? They're absolute sort of experts in that community engagement model. And also our partners at City of Yarra have also been extraordinary.
Are there any concerns for the tenants in the community, and how do you help them feel at ease?
I do know that once somebody is positive, you get put away and 14 days. But here with HRAR, we find way to connect with people, even though they are positive, they have positive case, just to continue calling them on the phone to ensure that, you know, you are okay every morning. The nurses come, we have nurses team, and then we have community like me, Liaison, and nurses check on them. And then if there is something need to be delivered, then we wear our PPE and deliver it. And I did, you know, going into extent in delivering a cake for a birthday.
Yes, we did.
How could I not mention this? We had someone who had a birthday in a lockdown, and we were able to reach there and tell them happy birthday and drop a cake at the door.
The other challenge we've had, though, is, you know, we had the outbreaks of 2020 and we had about 52 positive cases. But then we got that down to 0, and so we became more of a social program, which was really great. And we have a series of events every day. So we do Tai Chi, we do Zumba, Mahjong, line dancing. You know, we join with Barn to do Belgium Avenue to do the Twilight Markets. All these amazing sort of celebratory events for this local community and to celebrate their resilience. But we've had to pivot again, constantly pivoting. We've pivoted back to being this more acute clinical program to support the risks that we're seeing with the Delta outbreak. And that poses immense challenges, but it's also, you know, we know that we can lift to that and respond to that.
Is there a particular person or colleague in the community who makes your day a little brighter?
Uncle T.
Oh, yes. How can we forget him? Yes, the watermelon man.
Gosh.
We call him a watermelon man. That person he's grateful.
He is amazing.
He's very amazing. He's, you know, when you see people like him, you see humanity. You see people and you check on their heart. They've got heart to serve. I see watermelon man. He's not serving. He's not doing all this because he's working and getting paid. He comes and just do it because he's passionate about it. Me, Martha, I'm passionate about helping. And I'm passionate about helping women. And is it because it's something related to my story? Yes, it is. It could be. But the passion is the one that takes person to do things beyond their point of work. And I do appreciate what on that day, we were so hot. It was hot weather. And you dropped in a cold watermelon. And it made our day. It's amazing.
That's how he got his name. He's an elderly Chinese man that lives on the estate. And that's how we met him. He brought us cold watermelon, thanking us on the hard work we've been doing. And ever since that, he's been engaging with us, and we've been giving him flyers, and he's been helping promote being vaccinated by putting out flyers to some people that maybe we haven't touched yet. So yeah, and he's So
he's also started updating the daily case numbers. So he paced them. So he just walked. We just had our amazing morning huddle before, and he walked past with the daily case numbers.
What he does is that he has a bag that he has all the things in it, like everything he needed. He has tapes in it, scissors in it. He has all his work in it. So he has a bag he carry. And every time he asks for posters, he goes and he doesn't even ask for posters. He will not say, all right, give me posters. He will cut it and post it all over the house.
He probably prints them up himself. He's probably got his own photocopier.
Yes.
He's an absolute shining light, I'd say, for the whole team. And that's not to miss other people in community, because there are so many people in this community that bring us so much joy.
If you're out and about, you might run into Hatis. Hatis is a board member of NRCH. She's also a qualified electrician and a volunteer for numerous community groups.
I was finished the school. I've got a certificate for electrician. But when I came in Australia, I haven't got enough English. I can't do it. And I have to support my family to working on Church Street, the Melbourne Clinic. 18 years I worked there, psychiatric hospital over there, 130 Church Street. And I've got an injured in my shoulder, and then resign, and then I'm the pensioner and look after the people, helping to the people, working out, training.
Is there anything you want to say to the community now that we're out of lockdown?
Okay, everyone can think about still we're having a virus around, and if it's possible, take the time to going out most, and don't visit that day. Another couple of weeks, take your time, and then going to visit one person to one person or something like that, not going into the crowded. They can enjoy themselves, but take your time to be patient.
Hi, my name is Semi Imam. I live in Richmond. I've been living in Richmond for the last 4 years. So, yeah. I work for North Richmond Community Health in the Hurrah office. So my role is helping support officer. So pretty much we just go out to the community and support with whatever they need. You know, it could be a housing problem. It could be they need hand sanitizers, masks. It could be they need information about vaccinations. So yeah. I mean, so far we've got pretty good numbers of people getting jabbed, which is good, and we still need to work on the rest. It's not easy, but we getting there, and it's pretty exciting that everybody is realizing that get jabbed, there's more chances that you're not gonna get sick. I was one of the people that was positive before I got my vaccination, which I regretted because it didn't just only affect me, but it actually affected my whole family. and I wasn't vaccinated at that time, and I had to wait for 6 months to get my first jab after I came out of hotel quarantine. So yeah, it's just passing it from me to them. So it started with me and just passing it to my parents. And the whole time I'm just thinking like, if I just at least stay at home, this wouldn't happen, If we can just get a doctor or, an experienced person to come and talk to young people and explain like, this is serious and that they need to get their jab, which what I've been doing so far, and it's been successful so far. So
Yeah.
I could go as a Hurrah person and be like, hey, like you need to get jabbed, this is the information, blah blah blah. They might not take it, but then if someone from the community goes and like explains the situation and everything, there's a better chance of that person taking it. Get jabbed, stay safe, protect yourself, your family, your friends, and the community. Yeah.
Is compliance an issue in the community?
We have some major concerns about compliance, and that's really challenging. It's not our role to ensure compliance amongst community that are in quarantine, but it's deeply challenging when communities see someone that is positive, and they know because community talk and support each other, and they see that person out and about, and that. I think it's actually gut-wrenching to see people not comply with public health orders, because the impact on our amazing local community is the risk of more people turning positive because of that poor compliance. And so that's definitely, I'd say, one of our greatest challenges at the moment. I'd say, back in March, we would have felt that getting everyone vaccinated was our greatest challenge, and by word it was our greatest challenge, but we've risen to that challenge, and I'd say we've delivered more than we ever dreamt that we could to deliver. But we, take a moment to celebrate that, and then we keep moving. And so we also, I think, another challenge I'd say for communities is just not knowing. It's very abstract. I mean, you could hypothesise about when we think this pandemic's going to end, but none of us know.
What Laura and Brandon just keep telling us is that you have a work to do, and the work you need to do is just making sure that everyone around here is vaccinated, and that's the only safety that we can save you from what is going around. And this is what we are just focusing not in negativity in what's going on, whether the people have been seen walking around positive. Yes, that can be tackled by department, but then let's vaccinate a lot of people so that even if something like this happens, the community will be in the safe side, the children will be in the safe side. And I think that's the focus right now.
But we just have to reassure the community that we'll take care of it, and we just give them assurance that it'll be taken care of. And some of the people that are not complying obviously have other health conditions, like mental health conditions and things, so we have to be mindful of that as well.
We know that if you get Delta COVID and you're not vaccinated, regardless of how old you are or your health history, you are far, far more likely to end up in hospital and far more likely to end up in intensive care. So there are no people that are double dose vaccinated in the ICU. And so I think there has to be that point where some of these people who are still really just asking those questions, still thinking about it, I'll think about it a bit longer, say, you know what, it's time now. It's actually time for me to come forward and get that vaccine. I've got to put all those fears aside. And, my message to those people is we're here, we can walk you in, we can sit with you and make sure you feel safe in our space to get you over the line, because we don't want you to be in those statistics.
And that's exactly the example I gave some of them last week. I said, look, I can take an example of ABC that has happened, and people that are most affected and end up in hospital are people that are not vaccinated. And if you stay unvaccinated until this time, this could be implication. I'm just letting you aware. That's another conversation that I can come through. And it actually sounds very tough for a person to actually say that, but we have to for their safety. It's not easy.
I mean, somebody wouldn't like someone to die just because they're scared of a needle. So, as Laura said, we'll give them, we could walk you over to the clinic and give you support, emotional support, and be there with you when you get your needle. So I mean, that would be, I just would hate to think that someone died just because they didn't, like needles. So, so we're there to support them, and we can walk you over and give you encouragement, and we're there for you as a friend.
And if they prefer to do it through the GP clinic, they can do a one-on-one appointment with the GP. Just, there's no judgment here. We just want you to be safe.
And I think that's what's good to have. We live on the estate too, so they sort of they trust us and they believe in us. And there are a lot of people that live on the estate. They come from countries that were unsettled, and they dictators and things like that, and they don't trust the government. And if the government was knocking on their door, these weird people in jackets saying you need to get your needle, So when they see us and familiar faces, and they know that we live on the estate, they know our children live on the estate too, and they trust us. So that's, I think, a really, really big thing.
And to tap on to what Laura said, actually, because that point makes me actually feel what I felt when those two ladies called me on Tuesday about wanting their kids vaccinated, their teenagers vaccinated. Yeah. I was feeling so happy, and I'm like, wow.
So that was the turning point, Martha.
Yeah, that was the turning point. Yeah. That was the turning point, because I looked at it, I'm like, wow. So why does it have to take somebody getting sick before they realize that they need to be vaccinated? So those results that came positive were the results of people who were not vaccinated. They've seen how tough it is. And now even mothers are enforcing by themselves. They are convincing their teenagers to be vaccinated. How they do it is something that I need to question later. And I want to ask them how they do it, because I want to tell other mothers, mothers the same module they used to get their two teenagers vaccinated yesterday on Wednesday within the buildings here. Yeah.
How vaccinated is our community in the towers?
Most towers have 100% vaccinated first dose. Second dose data is obviously still increasing, but somewhere between, 70 and 95% for second dose, but we're waiting on the figures for this week. A little bit of work to do with some of our low-rise walk-up towers, which we'll continue to support. But it's safe to say, yeah,
if you've got 100%,
we're killing it, guys.
Yeah. If you've got 100% first dose, I just can't see any reason why they wouldn't be getting their second dose. Yeah. So, 100% first dose, that's just incredible. It's amazing. That is incredible. And as a worker, I feel so good to hear that all our work and all that time and effort's been to good use. We door knocked every single door in this estate.
How many times, Wayne?
Oh, more than twice. More than once.
Literally every door. So every tower's got 20 to 22 levels.
200 flats.
And then there's, 10 on each level. And it's safe to say that some community members might be thoroughly sick of the Hurrah team.
Oh, you again.
And there's been in-reach phone calls during last year. We tested the whole community last year. So thousands upon thousands of tests.
Like right now we find out that the only people who are not vaccinated, typically they have some health issues underlying, or they're skeptic about it, and then we're trying to find a way where we can reach those people and plan how to door knock one-on-one and speak to them. This afternoon I'm going to knock some doors as well. I'm going to go to some doors one-on-one to just have a second conversation. Of course they get sick of us knocking the doors, but we gotta have to do what we gotta have to do to look after the community.
They're not saying go away.
Yeah, they're not rudely saying go away. But yeah, you could see in their face Yeah.
It might take 10 times, it might take 20 times. These are just our final, and, we do it with no judgment. There is no judgment about that, go back to that human at the centre, to understand why someone makes a certain decision about their health, their well-being, their safety from COVID. You have to really understand their journey to get to that point.
That's right.
And I think that's critical, and I think we do that collectively as a team.
Is there a fun fact about you that you want the community to know?
I used to be a ballet dancer. That's quite...
Wait!
Yeah.
I had no idea.
So if you could just imagine me in tights. So
That is amazing. That is the best.
We're lucky we're on radio, not on television. So, but yeah, so I used to do ballet. Yeah, I was in the Victorian College of the Arts, and a lot of people I knew made it and ended up in the Australian Ballet. Yeah.
Wayno, it might not be too late to get you back into some tights.
I'm never too late for that.
I'm not sure I can match that, really. I hope people already know my passion for this community. I think I really hope that everyone understands this is not just a job for me. It's genuinely, I'm a human lover. I love humans. But I suppose when I'm not working or trying to have some downtime, I'm learning guitar. I have a dream of being, in a rock and roll band, and, I'm not too shy of having an audience, as you probably all well know about me now.
I'm a big undercover religious. I'm a Christian. On my day off or daytime, I pray a lot. I take time to pray. I take time to have encounter with Jesus. And I don't think a lot of people know, but it's something that actually it makes me feel delight, and it makes me feel like add hope into my life. That, at least there is some universe has not just appeared. There was something that created it. And if there is something that is beyond creation that create this beautiful place that we're living in, then it deserves to be, praised and, worshipped. And that's all about me. Another thing, I'm a very loving mom. I love my kids so much. And that's why I want to learn how to ride a bike so I can ride with my boys. I've got 4 boys.
I want to teach Martha, but it's just my bike's a bit too tall. So I was saying to Martha, you've got to get a bike, and then I'm going to teach you to ride around the housing estate.
I'm a single mom of 4 kids. I'm sorry to say that in a
It's
podcast.
amazing.
And
she's so strong.
I can only connect with my boys through a bike. I just want to have that ride. I can't wait to just have that long ride with them, leading them. And that's my part. I'm waiting for it now. Yeah, it will happen.
What's something you want the wider Victorian community to know about you and your work?
Don't be scared to come onto the estate. We're all friendly people. So there's lots of people that come onto the estate to get COVID tested, because we have a COVID testing tent here. And it's good to see other faces here coming onto the estate, because I believe that there's stigmas with officer housing and government housing, and especially the high-rise buildings that it's scary, don't go there. But please come, if you need to get tested, come and get tested. We're very friendly, open arms.
Totally, Wayne. I think that's so true. There's a lot of fear in what people don't know and don't understand and don't try to understand. And,
Well, I think that's a problem right around the globe with
Totally.
Government housing. It doesn't matter if you're in England or New York or Australia. I think it's that stigma will always be there, but we're not always. Hopefully we can break that.
And, I think it was also that public housing was, so with Yarra's, lower vaccination rates, we know it's been sort of in the media a bit, and we're trying to address that, and through our partnership with Yarra as well. And it was presumed by many, or it was easy to blame the culturally diverse communities and those that live on the public housing estates. And I had absolute joy in debunking that myth, to say, actually, no, I'm sorry, this is not about our public housing estate residents, and this is not about our culturally diverse communities. And so maybe you need to sort of look a little closer to home about, and I sort of say, our message to community all along around vaccination has been, if you don't want to do it for you, that's one thing, but do it for your community.
I would love to tell other people outside there, don't get scared, come to Richmond and to Hurrah, specifically if you really want to be vaccinated, or if you have questions that need to be answered, questions that need to be unpacked, that you have in your mind about vaccination that you're not aware of, we are here to welcome you with our arm opened to make sure that you have questions answered, and that you make a decision on the right path. Because as Laura said, you are making the decision not upon you, but for your family and others.
So some people are waiting on their second dose, or they have just decided that they would like to get the vaccine. What would you have to tell them?
Yeah, so we've got walk-in clinics on Tuesday, Wednesday, Friday, and also doing an evening clinic. I think the clinic's from 4:00 in the afternoon.
I think we've got hot potatoes.
Hot potatoes.
Hot potatoes, yeah.
We can't guarantee the Wiggles are going to be there, but
Yes.
we can guarantee you'll be safe when you have your vaccination.
They might. Nothing is possible. They might one day.
Maybe.
Yes, maybe we could. And you can book those through Hot Docs. So if you actually just Google Hot Docs North Richmond Community Health, you can jump on and book an appointment. You can also call us at the centre or come and see us at the white tent. So we've got 2 big white tents on the estate where we've got information, testing. We've got a beautiful Aboriginal art mural on the side, and which we commissioned during last year.
And now that restrictions are easing again, what's next for North Richmond Community Health?
Well, we're going to get our old programs up and running again, like our Zumba and our Tai Chi, and we're going to get the Twilight Market happening. That was a really success story. The Twilight Market was a market that started up a few months ago, and the residents can come down and have a stall if they want. And so it was engagement with the community we had blow-up castles for the kids to play on, and donuts and free popcorn and all that sort of stuff. And we had a really successful talent quest, I believe.
Yeah, Wayne. Wayne was the head, Mr. Talent Show himself.
Yeah.
Did a wonderful job.
And that was good. And the kids won prizes and stuff and got everyone together. And so we're looking to doing that again once the borders open and we're all out of isolation and getting back to having some fun.
So we did have a hosted women's vaccine clinic last week, or this week actually, and we are hosting a youth hub vaccine clinic on Friday the 5th of November, and that's over at the Yarra Youth Hub on the Richmond Housing Estate, and there'll be Nando's, music, slushies, Gelato Mazzina vouchers for kids to come and get vaccinated. So,
I mean, if I wasn't living on the estate and after hearing all this stuff, I'd want to live on the estate.
Yeah,
what do you just?
completely.
Oh my God!
What a joy!
Yeah,
what a joy! Yeah.
Thank you so much for joining us today. I hope that you've learned as much as I did about the Hurrah team and our community members. I really want to give a special shout out and a thank you to our guests, Wayne, Martha, Laura, Hatis and Samir. Thank you for your warmth and generosity in doing the invaluable work that you do and for sharing your experiences with us. Tune in next time. We're going to dive into Richmond Youth Hub. We're going to talk to some young people about the vaccine and also speak with a health professional to answer any questions that young people have about the vaccine. Until then, be kind to yourself, embrace who you are, because there will never be another person like you, and you're important. See you next time.